Steps 1 through 5 can be performed in any sequence. Assess the patient's urinary status, patient's knowledge of the purpose of catheterization, the need for assistance, the patient's allergy to iodine, betadine, or latex. We're going to check the medical record for the prescriber's order and for the type of catheter to be inserted, which is Foley catheter to bedside drainage bag. Oops. Gather your supplies: a waterproof pad, washcloth, towel, catheter kit, disposable gloves, extra sterile gloves, additional light source, and raise the bed to an appropriate working height. Identify the patient and explain the procedure. Provide privacy. Perform hand hygiene and apply disposable gloves. Place the waterproof pad under the patient. Assist patient to supine position with thighs slightly abducted. Drape patient's upper trunk with towel and cover lower extremities with bed sheet so only genitalia is exposed. For the sake of the checkoff, you won't have to pull the bottom sheet. Wash patient's perineal area with soap and water as needed. Dry area thoroughly. Remove waterproof pad, remove gloves, and discard. Perform hand hygiene. Place catheter kit on bed between patient's thighs. Open catheterization kit according to the principles of sterility.
I forgot to remove all of them.
Apply first sterile drape.
I'm going to square it up and find my corner.
Place over patient's thighs just below penis, touching only two corners as this is placed. Apply sterile gloves following principles of sterility. Pick up fenestrated drape and allow it to unfold without touching an unsterile object. Apply drape over patient's penis with fenestrated slit resting over penis. Prepare the contents of your kit. This may vary based on the packaging of the kit. Antiseptic solution. Will either be swab sticks or liquid. If swab sticks, tear it notch to open. If liquid, open and pour over cotton balls. Remove top to pre-filled lubricant syringe. And attach syringe. Remove the top to the saline fill syringe and attach to balloon port.
And again, here's where you can remove this blue sleeve.
So on the sheet, it makes it seem as if you're going to attach the lubricant syringe to the balloon port. You need to attach the saline syringe to the balloon port. So if you've got your notes open, make that a note because you're going to need the lubricant in a second. Retract the foreskin of the patient's penis with non-dominant hand. Grasp penis at the shaft just below the glands. Retract urethral meatus between thumb and forefinger. Maintain non-dominant hand in this position until catheter is inserted and urine is flowing well and continuously. With forceps, pick up cotton ball or swab stick saturated with an aseptic solution and cleanse the penis. Move the cotton ball or swab stick in circular motion from urethral meatus down to the base of the glands. Repeat cleansing 2 more times. Discard cotton ball or swab stick after each wipe. You will use 3 cotton balls or swab sticks for this. Be careful not to contaminate your sterile field as you discard the used cotton ball or swab sticks. Use dominant hand to pick up the opened lubricant syringe. Gently insert. Lost my place, I'm sorry. Gently insert the tip of the syringe with the lubricant into the urethra and instill the 10 milliliters of lubricant. Pick up the catheter with gloved dominant hand 4.8 to 7.2 centimeters or 2 to 3 inches from the catheter tip. Hold the end of the catheter loosely cooled in palm of dominant hand. Maintain control of the catheter. Lift patient's penis perpendicular to the client's body and apply slight traction. Ask patient to take deep breaths. Advance the catheter through the urethral meatus to the bifurcation or wide level of the ports. Do not force. If catheter resists entry, ask the patient to breathe deeply and rotate the catheter slightly. Grasp catheter securely with non-dominant hand or non-sterile hand. Slowly inflate the balloon with fluid from the pre-filled syringe using dominant sterile hand. Replace foreskin if present and lower the penis. Release catheter with non-dominant hand and pull gently to feel resistance. Position drainage bag below the level of the bladder. Do not place bag or on side rails of bed. Anchor the catheter, allowing sufficient slack for patient movement. Secure catheter tubing to patient's inner thigh with strap of non-allergenic tape or tube holder. Wash and dry patient's perineal area as needed. Dispose of equipment, drapes, and urine in proper receptacles. Remove and dispose of gloves. Perform hand hygiene. Palpate the patient's bladder. Ask them if they're comfortable. Observe character and amount of urine and drainage system. If more than 800 mils of urine return is noted upon catheter placement, clamp the catheter tubing for 10 minutes, then unclamp. Determine that no urine is leaking from catheter or tubing connections. Record and report catheterization if performed and patient's response to procedure and teaching concepts. Initiate intake and output records. Report absence of urine immediately. Sterility is maintained throughout the procedure. Follows correct sequence of actions.